it was kind of a fluke that I was there. I just went there to kind of be with my wife. I had a few extra minutes, and I went over there. They took my blood pressure. The nurse said to me, are you aware you have an irregular heartbeat? And I said, no. She took her glasses off. She was very emphatic. You need to get in to see a doctor immediately. This is serious. He was able to squeeze this in that afternoon. And he said, you're in AFib. He said, well, I was leaving Tuesday for this 500-mile walk in Spain. And he says, you're not going anywhere. You need to get in and see the doctor, a cardiologist, immediately.
So atrial fibrillation is the most common rhythm disturbance that we see in the world. And it's essentially a rhythm problem where the upper chambers of the heart beat extremely rapidly.
It was nice that Dr. Goldstein was able to squeeze us in and get the ball rolling.
Initially, when he was diagnosed, not only was it an AFib, but the heart function was poor, and he would have eventually gone into heart failure with that.
His first plan of attack was to try and get me back into rhythm. He put me on some drugs, Eliquis, a blood thinner, and then something to try and get my heart back into rhythm.
The first step in his treatment was a cardioversion, which is often the first step in AFib. It's simply shocking the heart back to normal rhythm once we have appropriate blood thinning on board.
That didn't work, and so then eventually we did the ablation, and so that seemed to produce some good results. I decided to go get the chest x-ray. I leave. Half hour later, we get this frantic phone call. You got to check yourself back into the hospital. You've got a collapsed lung. And they set me up with a procedure to go in and do an exploratory type thing. And they found out that I had a bleb as opposed to a collapsed lung, and they resectioned part of my lung. So it was a blessing. If I had been on that walk and then that would have burst, it could have been probably catastrophic.
In a hilly, mountainous area where oxygen levels are lower at that elevation, that would not have been a good thing for him. I imagine eventually he would have been hospitalized there.
After Dr. Goldstein gave me the green light in February, we rebooked our tickets and it all worked out. It was almost very emotional, just reminiscing getting through that 500-mile walk, from start to finish and whatever. It wasn't until they gave me my certificate that I had walked the 779 kilometers that, wow, I did it. Well, that was an awesome experience. Just so grateful. Wanted to say thank you for possibly saving my life.